Hi, I'm Dr. Jacobs. A lot of my patients have questions when it comes to dental x-rays, like why do we need them, how often do we take them, or whether they're safe. Those are all great questions and definitely not alone in wondering about them. The truth is x-rays are quick, safe, and one of the absolute best tools we have to spot small issues before they turn into big problems. I've put together some answers to the most common questions I hear every day so you can feel comfortable and confident the next time you're in the dental chair. Dental x-rays are, like the name implies, an x-ray. It's a beam that goes and images your tooth. It can see through hard tissues like enamel. The old traditional x-rays were chemical-based. We had to use film. I don't know if you remember, but there was film in our cameras before. That film has to go through a chemical process, and then you can see literally an x-ray of your teeth. It was hard to see. They were very small. You could not handle them. But thankfully, nowadays, we have better things. We have digital x-rays. So they're not x-rays in the sense that we have a film that we look into. This is all digitized. And there are many advantages. So digital x-rays are faster image capture and display. Within a second or two, you can take your x-ray and it appears on the computer screen. You can manipulate it, make it smaller, bigger. You can send it to your friends or share it with other colleagues to get their opinion. The most important part is that they are lower exposure. Dental x-rays are measured in microsieverts. Doesn't mean anything to you probably, but you can relate it in terms of a single day exposure that occurs if you're walking out in the street. So to have lower radiation, you get a much better image quality. You can spot cavities when they're small and easier to fix and cheaper to fix. There are no chemicals that are harsh to the environment. That is a big plus. It has improved patient experience because we can quickly correct an x-ray, make adjustments, say it's too dark, we can manipulate it with our computer tools and not have to often retake the x-ray. And like I said, we can share it with colleagues or insurance carriers much quicker. Going back to radiation, microsieverts. To give an example, we get radiation all the time. And when you eat a banana, it's 0.1 radiation microsieverts you get. A dental x-ray is 0.2 microsieverts. So one x-ray is like eating 2 bananas. A full set of x-rays, all 18 to 21 x-rays, is 4 microsieverts. If you get on an airplane from LA to New York City, for example, you're getting exposed to about 40 microsieverts of radiation. So that is a 10 times fold. 4 microsieverts for dental x-rays, 40 for taking an airplane flight from LA to New York. If you live in a brick building, just living in a brick building, is 70. And to put it in perspective, just from all the foods we consume, you get 400 microsieverts in the food you ingest in a year. So 400, that is 100 times the full set of x-rays just from eating your food. 100 times more radiation from eating your food in 1 year. We often take the full mouth set of x-rays once every 3 to 5 years. So put that in perspective. 1 to every 3 to 5 years for a full set of x-rays, which is only about 4 microsieverts or 400 just in the food you consume. Another way to look at it is 1 x-ray is equal to 1 day of naturally occurring radiation out in the sun. A full set of x-rays, it's about 7 days. No big deal. We nowadays use cone beams. A cone beam is a three-dimensional x-ray. It's the most important thing we have in dentistry, in my opinion. We can do lots of things with three-dimensional x-rays. A cone beam is equal to 11 days of sun exposure. If you go to your physician and you get a CT of your abdomen is equal, get ready for this, 3 years. 3 years of what you get in the natural occurring environment. So a cone beam, 11 days, an abdominal medical grade CT, 3 years. Tremendous difference. No need to be afraid about dental x-rays. So the purpose of a dental x-ray is to detect a cavity. As I mentioned before in other hearings, a cavity is just acid in your mouth, either produced by the food we take in, Gatorade, soda, or bacteria in our mouth that create excrement that is acidic and will erode the enamel of your tooth. It's like rust on metal. Once a hole forms on your tooth, a dental x-ray will be able to pick that up when it is small. Often we cannot see it in your mouth with a naked eye. That small cavity means we put in a small filling and you're done. If that's not caught early and the cavity grows until we can see it with our eye, by that time you'll probably need much more expensive dentistry, even a crown. If you wait till it hurts, it becomes thousands of dollars for a root canal and a crown. So it is important to take an x-ray, save you a lot of pain, expense, money, lots of money. I'd rather get a small filling than a crown or even a root canal and a crown. So don't be afraid. Have your dentist take the x-rays and he will fix things easily, pain-free, and with less cost to you. So another thing people wonder is if you can spot gum disease with an x-ray. The answer is you can spot bone loss with a dental x-ray. We know where the bone should be, and on an x-ray we know where it should not be. When you have gum disease, you have lost bone from where it should be. You then have to determine if that is active bone loss. If it's occurring, meaning like tomorrow you'll have lost more bone. We do that by looking at the health of your gum. If it's red, inflamed, bleeds easily, you have active disease. You will lose more bone every day. If you have had that treated and your gums are pink and firm and they do not bleed, it could be a history of prior bone loss, but it's not continuing. You have cared for it well and it is under control. So on an x-ray, you can see bone loss that has already occurred, whether it's a chronic stable condition or a fast-moving acute condition that needs urgent care. You need to see your dentist, have him take x-rays, and you and him both can have, or her, can have a good discussion about what's going on in your mouth. So next time you go to your dentist, ask him any questions you have about x-rays. I'm sure he will be able to answer them. If you need any help from us, you can always reach us at Riverside Center for Aesthetic Dentistry. That is Riverside Center for Aesthetic Dentistry with an E. You can always call us, 951-683-0880. 951-683-0880. I hope that I answered all your questions about dental x-ray safety, and don't be afraid, it's only a benefit for you.